Hello and welcome. I'm Dr. Lakshmi and you're watching the Health Talk session by Yashoda Hospitals. Knee replacement surgery is one of the safest and most successful surgeries ever performed across the globe. It helps you to continue living a healthy and active lifestyle like before. So let's discuss about total knee replacement surgeries in our today's episode. Joining us today, we have with us Dr. V. Ram Mohan Reddy, consultant orthopedician surgeon from Yashoda Hospitals, High-Tech City. Welcome to the program, Doctor.
Oh, thank you.
So doctor, total knee replacement surgery is one of the most commonly performed surgery in India. So can you briefly explain what TKR is?
Thank you for the question. Total knee replacement means changing the arthritic knee joint to an artificial one. It means putting in metallic components to the thigh bone and the leg bone and placing a plastic insert in between these two metallic components. So total knee replacement means three components: metal, plastic and metal.
So doctor, you've mentioned that the joint is replaced by metals. So can you briefly explain to us what materials are used for this surgery?
There are various materials that are used in total knee replacement. The most common material that is used is a chromium cobalt steel material for the thigh bone component, chromium cobalt steel material for the leg bone component. Very few companies use titanium components for the leg bone. As far as the insert is concerned, it is made up of poly material, which means plastic of high density molecular weight material, which simulates the cartilage. It functions like a cartilage. Now, there are other materials which are available for the thigh bone. One of the most advanced material is the ceramic oxynium material. This material has shown in the lab studies that it works well for over 30 years. Few other companies have started manufacturing based on titanium alloys. There are basically three main materials for thigh bone: chromium cobalt steel, ceramic oxynium and titanium based alloy. For the leg bone, it is either titanium alloy or chromium cobalt steel. There is no other material as far as knee replacement is concerned.
So according to a recent survey done in India, more than 2.5 lakhs of patients every year get this surgery done. So when do you think one should consider the surgery, doctor?
That's a very good question, and most of the patients keep asking me when is the right time to get the surgery done. Now, there are few factors patient and the surgeon should discuss before going ahead with the surgery. Number one, is the knee really arthritic? There are 4 grades of arthritis. Minimal arthritis means less than 25% arthritis. Grade 2 is 50%, grade 3 is 75% and grade 4 is 100%. How do we decide what's a grade? A simple standing X-ray of the knee joint will tell us whether the knee is arthritic or not. When the gap between the two bones reduces and the bones come to stick to each other, then it means it is severely arthritic. Does the patient need a knee replacement when it is severely arthritic? The answer is yes and no. If the patient has no symptoms, then they can delay the surgery. If the patient has got significant pain, limping and not able to do daily activities, what you call ADLs, activities of daily living. If the patient is not able to stand for more than 15-20 minutes and not able to walk for more than half a kilometer, and if the pain is disturbing the sleep, then it means that the patient is ready for surgery. One has to be very careful when planning for surgery. If there is no significant pain, then delay the surgery, but at the same time keep fit by doing exercises and having a good diet. Only when the pain is severe and not able to cope up with the minimal daily activities, then it is time for total knee replacement surgery.
So talking about TKR, doctor, what are the recent advancements in this field of surgery and what is the role of robotics?
In recent times, there are a lot of advances which have come into the knee replacement surgery. It started off with computer navigation and then patient specific instrumentation, and at present robotic system. As far as the robotics are concerned, there are different varieties using different software systems. The one robotic system is where the surgeon controls the equipment. The landmarks are fed into the system by the surgeon. The equipment, the robotic equipment summarizes and then gives feedback back to the surgeon saying what type of cuts to be made. Here the surgeon does the actual surgery but not the robotic equipment. So this type of robotic system is very safe, simple and easy to practice. The second system is where a CT scan has to be taken before surgery. These CT scan films have to be fed into the system, after which the robotic equipment gives the landmarks for the surgeon who then does the surgery. Now there is another robotic system where the landmarks are given to the robotic system. The surgeon is not operating, but it is a robotic arm which does the bony cuts. So the first two systems are a bit safer as compared to the third system. Again, as I said before, robotic equipment gives you only landmarks based on that particular implant. One cannot use another company's implant. The patient has to be very aware. If they plan to choose a certain implant but want to use a different kind of robotic system, then it does not work.
So we've discussed about different techniques and robotic systems. So are there any factors that you consider for the best possible outcome, doctor?
What are the patient factors? The first factor is, does the patient need surgery? If the answer is yes, then we need to assess the spine and the hip. Sometimes the knee pain comes as a referred pain from these two areas. The other factors that need to be considered are, does the patient have any medical problems? Most of the patients are elderly who need joint replacements, and they have medical problems like diabetes, thyroid, heart and lung problems. A very thorough assessment and then the support of the physician, cardiologist and the anesthetist is definitely needed before we plan and put the patient on the list for surgery. The other factors that are important are, does the patient have bone softening, that is osteoporosis. If there is osteoporosis, then we have to start treatment parallelly in consultation with the rheumatologist. So a knee replacement is not a simple surgical procedure. It needs a lot of pre-op planning for a successful outcome.
So we know that with advanced technology that TKR is a very safe surgery. But are there any complications associated with the surgery, doctor?
Yes, are there any complications? Yes, there is a big list, but as long as that patient is preoperatively assessed and operated upon, the complications should not happen. What are the common complications we counsel the patient for? Number one is blood clots in the leg, which can go to the heart and lungs. If the patient is well hydrated, mobilized early, then blood clots should not happen. The second risk or factor or complication is infection. To do a knee replacement, you need advanced facilities like the theatre system. You need laminar flow air filters to reduce the risk of infection. These laminar flow systems reduce the bacterial load in the air and keeps the patient safe. Other complications that can happen is fractures. If the bones are very osteoporotic, then one has to be careful about handling the bones. Proper vigilance, recognition of the problem and repair of the nerves and blood vessels should help the patient get back to recovery. As I said before, the risk of complication is less than 1 to 2%, But as long as the team is well trained to do the procedure, patient should walk away free and safely from the hospital.
So as with every surgery, the recovery period is very important. So what is the role of physiotherapy for TKR doctor?
A lot of patients come to the hospital and then they express their fear saying physiotherapy is going to be very difficult. They have the impression that physiotherapists force the knee joint for knee bending and straightening. Some of it is not true at all. It all depends on how the surgeon operates. The tissues have to be held very gently, the muscles have to be repaired properly, the implants have to be positioned and fixed with cement in the correct angle. Post surgery, we give rest to the patient for a day. After overnight recovery, the next day we make the patient sit and then mobilize whenever they are comfortable. Physiotherapy plays a very important role. Now, exercises is not just to the knee joint, but exercises to the hip muscles and spine is very important for the patient to walk properly after knee replacement surgery. If the physiotherapist trains the patient, within 3 to 4 days, they will be able to walk independently with the help of walker support, walk up and down the stairs without much problem. Now, there is a wrong concept that robotics helps to reduce the physiotherapy. It's not true. There is no correlation between robotics and physiotherapy. Both are independent, both are needed for a successful outcome.
So before ending this episode, doctor, what message you would like to give to our audience out there as far as total knee replacement surgery is concerned?
Patients who are looking out for knee replacement surgery, my first advice to them is do your research properly. Don't get surgeries done on a impulse. You need to make a decision whether you need the surgery or not. That's number one factor. It is a very safe, reliable and reproducible surgery. For the surgery to be very successful, the patients have to choose the hospital with the best facilities. That's very, very important. And at the same time, the hospital should have a very good management program, including the nursing team, the physio and rehab team. Of course, with all these facilities, the surgical team is also very important, who have been trained in joint replacements. So, a good qualification with expertise, experience and a good implant will give a successful outcome to the patient in a very well advanced equipped hospital.
So thank you, doctor. It was wonderful having you here on our program today.
Thank you.
So this brings us to the end of this episode. Hope this episode was informative on the topic total knee replacement surgery, and don't forget to join us for the next week as well. Until then, take care and stay healthy. Thank you.